am Dr. Smita Gutgutia, consultant obstetrician, gynecologist and laparoscopic surgeon from Kolkata. Today we are going to talk about postmenopausal bleeding. It is a very important subject for us, for our mothers and also for our grandmothers. So first thing, what is menopause? Menopause is where we stop having periods for at least 1 year of our life. Usual age for menopause is after 45, somewhere up to 52, 54. If you've not had periods for about a year and post that if you suddenly have bleeding, it is something that we need to approach our healthcare provider. Most of these bleedings would be because of benign reasons or insignificant reasons which are not important for your life, but there is about a 30% chance that it could be an indicator of a malignancy happening in your genital tract, vaginal, cervical, uterine, sometimes even ovarian. So let's make things simple. We go to our doctor, let them examine. If they want to do a couple of tests, allow that and find out why this is happening. Most important causes would be postmenopausal atrophy because of lack of estrogen after menopause. Sometimes benign lesions like polyps, in common language we would call them probably achil or masa. So these polyps are small growths which can happen inside the uterus or on the cervix and lead to bleeding off and on. Very simple things to treat them, we just remove them and you're done with it. Sometimes on an ultrasound we find that you have a thick inner lining of the uterus which we call the endometrial. Usually when you have periods it keeps shedding off and coming back again, but postmenopausal this endometrium is supposed to remain very silent and not grow. So if it grows at some point of time, we have to understand why it is growing. Again, it could be because of simple hypoplasia, which is not significant and is medically treatable. But sometimes this hypoplasia has a chance of getting converted into a malignancy. So we need to recommend what we have to do for that. Most people, as I said, 70% women do not have any malignancies, but we need to treat this postmenopausal bleeding. But 30% women who are at high risk of having a malignancy would be suggested to have a hysterectomy, that is removal of the uterus and the organs. Let's talk about a few basic tests which may be necessary to identify the cause. One of them is a pap smear which is recommended for everyone every year. The other test could be a transvaginal ultrasound where we look at the uterus, ovaries and the inner lining of the endometrium. Very two basic tests, I think everybody should have it. There is no fear of coming to the doctor and you do not imagine things that doctor would do this, doctor would do that. Simple things first, difficult things later, right? So let's worry about ourselves, our mothers and grandmothers so we can take good care of them. See you.